No fewer than 5,000 patients across Ogun State will benefit from a free mass health outreach organized by the Collective Club of Shagamu in Ogun State in fulfillment of its corporate social responsibility. The free healthcare scheme, which will last for 1 week, will handle blood tests, eye blood tests, free medical consultation, dental checks, malaria tests, PSA tests, diabetic tests, eye tests, free medicine distribution, free reading test classes, and free cataract surgery. Speaking to newsmen after the flag-off, the president of the Collective Club, Remo Ogun, said free healthcare outreach was done in conjunction with the state-owned Olabisi Onabanjo University Teaching Hospital, OOTA, Shagamu.
We're going to diagnose. As he said, we have to find out the problem that people have. We have the doctors here with their tools and equipment to find out what is going on with each individual. After we have diagnosed, we're going to prescribe the drugs, which we have many of it here. The drugs that they need, we're going to be very generous and ensure that we give them enough dosage to last them to treat the ailment they have. And during the diagnosis, we will detect some people that have even more serious problems that we cannot solve it. So those kind of patients, we're going to refer them to Olabisi Onabanjo University Teaching Hospital. We have that understanding already with the teaching hospital that they will go and do further operations. That was what we did last year.
He said the club organized the free medical service based on the love they have for their people. He said the medical exercise captured 3,000 patients, revealing that this year's projection to attend to 5,000 patients.
You look at our society and you look at how much requirement is needed for us to function properly. And as the PAMSEC said, you look at what the government is doing, there is no way if you're in a position to support and you have a good heart that you will not be motivated to do what we're doing. When I made my speech, I made it clear that the Collectives Club are doing this out of love for our people. It's really deep in our mind that, look, we have to support our people. But I can tell you the drugs that we have here are in tens of millions of naira. We got most of them free of charge, through the relationships that we have in the United States.
Governor Abiodun in his remarks commended the club for the initiative, saying the medical outreach has impacted positively on the health system of the state. Abiodun, represented by the Permanent Secretary, Ministry of Health, Dr. Kayode Oladeyinde, called on for more support in the health sector, saying government cannot do it alone.
This is, of course, going to impact positively on the health system in Ogun State. I mean, there are so many people that are here today that will not be able to, of course, pay for their health services, for their health needs. But you see, the members of Collective Club had come together and said, no, we are going to take care of that. We are not going to leave the government of Ogun State to do it alone. No matter what the state government does, we will still need people, good people of Ogun State, like those members of the Collectives Club, to assist the government.
Some of the beneficiaries who spoke to journalists commended the organizer for organizing the medical outreach.
Well, it is a good idea to many of us, particularly for my own self, because this health talk is very necessary. I'm a retired teacher. You know what is happening in the country now. To look for health, you have to get money. But when you see free health, you have to go there for your long life. Health is wealth.
They should continue doing it so that we Remo members will be okay. They're benefiting from them because it's a very good program.
You know that the government cannot do it alone. That the government too should continue to support them in every area. And I want them to extend it to other places where they have not been to, so that people will also benefit from this. It's a good thing.